Broward Health North in Florida has been working to reduce their total patient harm rate.
Hi, I'm Denise Mansfield. I'm the Regional Manager for Quality Management, Epidemiology, and the Patient Safety Officer for Broward Health North in Deerfield Beach, Florida. I think what we're most proud of is the changes we've made in chasing the zero and reducing patient harm, but also the transparency and the honesty of our message and our reporting mechanism. So we probably started our journey 10 years ago, and we've had consistent C-level leadership in that time frame. And we're very blessed to have an incredible CEO who was always willing to drive that change. I think it's been a long journey, over 10 years, to our path to reducing patient harm. But if I think of a recent defining moment, we became involved with Hospital Engagement Network through the FHA. And that was the first time we actually looked at all harm events as one global thing that we add together for cumulative effect. We had previously studied and worked on in individual teams reducing all the different separate patient harms. But about a year and a half ago, we rolled up to where we go to total harm, and we report a total number, and we set at even the strategic level in our strategic plan, and through the evaluation of all leaders in the building, what we're doing to reduce patient harm. So we look at how many we had last year, we set a % reduction target, and we work tirelessly towards that. So looking at the composite total harm has a different impact for patient safety for us in that we used to, for example, across nursing, look at trying to reduce the fall rate on every unit. And we do great with that. We have a very low fall rate when you look at us by national benchmark. We bench internally and externally, and we always want to beat whichever number is better. But now we look at total harm, and from that, their unit-based team works on reducing that. So in one unit, it may be catheter-associated urinary tract infections, but in another unit, it may be falls, and in a different unit, it may be hospital-acquired pressure ulcers. And so all that rolls up, but everybody works on everything, and then additionally, they work even more at the thing that they have the greatest opportunity at. So I think the thing about looking at total harm is that focus keeps you from being complacent. So for us, we would look at different components of total harm, and we'd say, we've had a really low fall rate for years and years and years. We've probably reduced our fall rate by maybe 50% for 6 years in a row. And if you put all of our separate harms together, we actually continually reduce them. But when you put them all together as a composite, it's really impressive how moving that is and how many people that impacts.